into the medical now and what this means, like you just asked me. So what this means, and as Representative Wills said, there are only two current ways that the American College of Obstetrics and Gynecology recommend doing this type of test if it needs to be done. One is called chorionic villus sampling, or CVS, which can happen between weeks 10 and 13. And it's a giant needle that would be inserted directly into the sac on the side of the placenta with the fetus, the developing fetus, take some of that tissue directly from the developing fetus to determine paternity. Now, this has a high risk of infection, of actually causing fetal abnormalities from how that tissue is taken, and can even cause a miscarriage or preterm labor. The second type is an amniocentesis, which can happen starting at week 15, in which we put a needle into the amniotic sac. It's a long needle, goes directly into the amniotic sac to take some fluid. This also has high risks of infection, preterm labor, and causing termination of that pregnancy. Now, in the case where there is a medical reason to do this, that is why we have this technology available. But what concerns me is the same thing that so many of my colleagues have raised on this floor already. That a mother, against her will, perhaps one that has undergone sexual assault or domestic violence, could be forced to have a jab, a big jab, directly into her body, directly into the space where she is growing a child, at risk of losing that pregnancy and without her consent. That doesn't sound like we're respecting the person, the individual, the mother, or the child. Every single OB-GYN, obstetrician and gynecologist I showed this bill to, and I showed many in the state of Iowa as well as outside of the state of Iowa, because I wanted their interpretation. I might be a doctor, but this is not the work I do every day. And their biggest concern with this bill was that they would be forced to look one of their patients in the eye and tell them that even though you do not want this risky test, I have to do this because the court is ordering me to do so. Abandoning their medical ethics and their promise to always do what is best for the patient. That is an issue with this bill. Not only does this bill further stigmatize mental health the way that we discussed in that first clause, it puts the mother in pregnancy at risk without her consent. It enables that opening. I ask you, please respect Iowa's mothers. Let's keep them as safe as possible, and we have to vote this bill down. Thank you.
Chair recognizes Representative Winchell.
Thank you, Mr. Speaker. Mr. Speaker, at this time I defer on House File 2363.
Are there objections? Hearing none, so ordered.